So let's talk about beta blockers. Beta blockers block beta receptors, and beta adrenergic receptors may exist in the heart where it has beta 1 receptors. And by blocking beta 1 receptors, we decrease heart rate and we can decrease our contractility of the myocardium, and that's going to decrease your stroke volume. And as a result, your cardiac output is going to drop as heart rate times stroke volume equals to your cardiac output. And decreasing your cardiac output is going to decrease your blood pressure, as blood pressure is simply total peripheral resistance or blood vessel resistance, which is blood pressure times your cardiac output. And we can also act on beta 1 receptors in the kidney. We're going to draw a kidney bean. And by blocking beta 1 receptors in the kidney, we decrease the release of renin from the juxtaglomerular cells of the afferent arteriole, or the arteriole that is entering into the glomerulus. Regarding side effects of your beta blockers, we can cause a decrease in blood pressure significantly, and that can cause hypotension. We can accidentally blockade other beta adrenergic receptors, such as the beta 2 receptors in the lungs, and that will result in bronchospasm. So it's contraindicated in asthmatics. And in myocardial infarct, that would be one of your first line uses of beta blockers in hypertension, because beta blockers will reduce cardiac output and thus oxygen demand of the heart, especially when you have coronary artery disease. And also in heart failure, it prevents the sympathetic overactivation in cardiac tissue. Some other side effects of beta blockers is that it can cause vivid dreams or nightmares. And since you're blocking heart rate significantly, we can also potentially cause a decrease in AV block. Decrease in heart, and we can cause a decrease in heart rate or AV block.